CEO of Carilion Clinic. Nancy began her career as a nurse, receiving her bachelor's from UVA and her MSN from Emory University. She served as Chief Operating Officer before becoming Carilion's President and CEO in 2011. Nancy was a key architect of Carilion's partnership with Virginia Tech that continues to transform the region's economy. Beyond Carilion, Nancy is a recognized national healthcare leader. She is, now just listen to all this. I know you've read some of it outside, but let this sink in. Beyond Carilion, Nancy is a recognized national healthcare leader. She is a past chair of the American Hospital Association, perennially named among modern healthcare's 100 most influential people in healthcare, and to Virginia Business Magazine's Virginia 500 Power List for the last 4 years. Nancy chairs the Virginia Growth and Opportunity Board, also known as Go Virginia, the Virginia Foundation for Independent Colleges Board, and the American Hospital Association's Coalition to Protect America's Healthcare Board. She also serves on the boards of the Virginia Economic Development Partnership, Virginia Business Council, Virginia Business Higher Education Council, and the Governor's Advisory Council on Revenue Estimates. In January 2022, Nancy was selected by newly inaugurated Governor Glenn Youngkin to serve on his medical advisory team. Please join me in welcoming an absolute jewel in the Roanoke Valley, Nancy Agee.
My goodness, Wendy, that was quite an introduction. My parents, who've long since passed, would have been very proud of all that. And I think you all would probably say, well, what do you do for fun? And some of you might say, I thought you were in healthcare, and that sounded an awful lot like economic development and, finance and the whole business world, and they're completely intermingled, aren't they? But I have to admit, sometimes I wake up in the morning and I think, what hat do I put on? Is this about economic development and really developing our region, which I spend a lot of time doing, and working with the Commonwealth, because, a lot of people in Richmond think the state ends in Charlottesville, and we have to remind them there's a whole lot more of Virginia out here, and we're incredibly important. So thank you for that very, very kind introduction. There's two or three things she didn't say. So I have a husband, I have a son, and I have 2 grandchildren. So what do? I spend all my time with my 2 grandchildren. And I had them this weekend. William is 4, Eva is 2. I needed to come and be with y'all so I could rest. So if y'all don't mind, it's just such a joy. It's such an incredible time. But I want you all to keep me in your thoughts and your prayers, because in December I am taking them to Disney World. So that's my story. Oh, and by the way, I have a dog, and that's probably the most important thing. Preston Bogus and I go way back, as do many of you all in this room, but he will probably remember this story that I used to tell often, and that is that when I was a little girl, I was about 5 years old, and I got 2 things for Christmas. I got a nurse's kit with a little nurse's hat and a puppy. And so since about age 5, I was actually 4.5, I knew I wanted to be in healthcare, and that was my passion. That's where I wanted to spend my time. That's where I've spent my whole career, starting as a nurse. And I loved animals, and that poor little puppy, he kind of got the bandaging and the whatever, probed and tolerated me. And I have not been without a pet ever since. So my little pet Henry is Henry now, Henry 2, because I had Henry 1. When Henry died, I got the same breed, called him Henry 2. I'm not very creative, as you can see. So let's get started. I understand we are broadcasting this throughout Brandon Oaks. So for those reasons, we'll stick with the slides, and I'll do more reading than I might ordinarily do, but I'm happy to answer questions. You can interrupt me at any time if you like, and afterwards we'll talk about we'll have some Q&A if you like, if that works, Randy. Okay. Well, they say push this button. The first thing we're going to do is see a little movie.
Successful program at Carilion Clinic received statewide attention today.
The fresh food comes straight from the Carilion Patient Garden in Roanoke.
Shoes for Hope is a fun way to raise money to fight pediatric cancer.
For 40 years, Carilion Clinic has been Southwest Virginia's only Level 1 trauma center.
Improving and expanding trauma care for patients in Southwest Virginia.
Carilion Clinic is one of only 22 locations in the world offering the Tapestry study.
This is groundbreaking stuff. I mean, I'm very honored to have been chosen to be the principal investigator.
So how can I possibly tell you in a half an hour the incredible things that are happening at Carilion? It is so exciting to me. But you know what? We're building on the shoulders of giants, and some of them are in this room. And if I started naming everybody, I might miss somebody. I'm looking around the room. We've got Dr. Hollingsworth, Dr. Bogus, Dr. Henning, Dr. Black stuck his head in. There are so many people who meant so much to this region. And so if I'm doing anything, it's really building on the shoulders of giants, and very grateful to you all and what you've done. So let's talk a little bit about what's happening at Carilion, but we'll go back in history a little bit. You know, just before the turn of the last century, that would be 1882, nobody in here remembers that, but you probably know, if you know anything about Roanoke's history, Norfolk and Western set up headquarters and began building a railroad in Roanoke. They brought in immigrants from largely Scotland and Ireland. It was easier to bring in, because of the immigration rules at that time, European immigrants to work on the railroad. Well, those people weren't absent from disease, right? Infectious disease was rampant, like malaria, smallpox, typhoid fever, tuberculosis, gonorrhea, syphilis, and leprosy. And besides those dreadful diseases, the immigrant laborers experienced severe injuries and infections. But medical resources were scarce, and immigrants weren't welcomed in most of the smaller hospitals in the region. And so as illnesses and injuries and infections mounted, the townspeople became concerned, and our community's poor health would threaten the railroad's success. Isn't it funny? I started talking about healthcare and the economy. Well, we go back to the railroad and its success and the economic prosperity that brought needed good health care. So they opened a little hospital for all comers, regardless of their ability to pay. That little hospital on the hill is now a nationally ranked health system, and that's the flagship, actually the hospital in which I was born. And fidelity to our mission shines brightest in our times of greatest needs. And because we are mission-driven, we put people ahead of profits. Looking back at the past 3 years has been both sobering and extraordinary. There are a few silver linings to those deep and dark clouds, but it's been a very hard time. Looking back, in the face of the ongoing health pandemic, supply chain issues, staffing concerns, financial challenges, and more, I would say we and our incredible staff were resilient and focused, and we continued to provide the breadth of clinical care that you and your loved ones expect. Today, I'd like to focus on 3 things. 3 of our great achievements, 2 of our biggest challenges, and 1 way that you can help. So let's get right to it. First is something that can make our minds explode, and that's the digital transformation taking place. I've just returned from Chicago on Friday, right before I picked up the grandchildren, with 3-day deep dive into artificial intelligence and machine learning and what that might mean for healthcare. It's really pretty fantastic. Well, the pandemic was, some of the silver lining of the pandemic was that it taught us that care can be delivered virtually. And importantly, patients liked it. After face-to-face visits resumed, we've continued to meet patients where they are by scaling telemedicine services across all care. We've introduced an array of virtual options and digital tools. Urgent care is now available on demand through our Carillion Now mobile app. If you need urgent care, you actually can get it on your phone. From the comfort of your home, you can see your provider 24/7, and you can have a prescription sent directly to your pharmacy. Imagine that, Dr. Hollingsworth. Demand is driving the same kind of convenience for mental health services. And for needs that are maybe less immediate, less urgent, we offer online scheduling for in-person primary care and pediatric appointments through MyChart. If you don't have MyChart, I strongly encourage you to get this online portal. You have all of your medical information at your fingertips. You can share that with whoever you want, maybe a sibling, a child, a spouse, so that you can share that information and they can help you through difficult times. We also employ virtualists, so primary care physicians who never see a person in person, only through the screen, and that's really taken off. So their offices are in a telemedicine hub, and we're adding to that group of people who only work online. And we're using smart telehealth exam kits in primary care and extending this to our rural patients. So this is an office that we opened up in Bluefield, West Virginia, where it's a primary care office, no physician present, and we're doing this through telehealth. And you can get these kits now that the patient can have at home, and the provider, the physician, can actually listen to the person's chest, can look in the person's eyes, can look in their throat, all that done virtually. It's amazing, space age. We think this Bluefield Center then is a harbinger of things to come. It's sort of an experiment for us. If this is working well, then this will be a new way for us to provide more care in our rural areas. You know, if you think about it, our service area, if you drive from one end to the other, is about 4 hours long and pretty sparsely populated as you head west. So it's hard to have enough services for people who need them because you don't have that many people around. So if we can do things electronically using telehealth in some smaller centers, it can make a real difference to people's health, especially in the rural areas. One day soon, you might even receive hospital-level care at home. That's not home health. That's actually hospital-level care at home. We're part of a small elite group of systems nationwide that the government has certified to provide hospital at home services, and we're just beginning that program. Well, digital transformation was one big achievement I wanted to talk about. The second is quality of care, and continuing to deliver care that's of the utmost quality is the most important thing to me. However, and wherever you want it is another big one. So virtual care and quality care work together hand in glove. Carilion Roanoke Memorial Hospital, some of us in this room still refer to it as Roanoke Memorial and kind of drop that Carilion name. That's okay, I do it all the time. Is routinely among the elite 12% of hospitals nationwide recognized by U.S. News and World Report's annual best hospital rankings. Those rankings are meant just to guide consumers seeking specialized care in the very best place. Now, this is important. You can get sophisticated, world-class care right here. There's no need to go, we're not yesterday's news. We've brought in several hundred. We now have 1,000 physicians and providers, another 350 residents and fellows providing care. We're almost surgical. We're very focused now on bringing in very significant world-class specialists along with a strong primary care network. So you can get all the sophisticated world-class care you need and want for yourselves and for others right here. U.S. News also rates sort of the more common procedures and conditions such as hip replacement or diabetic care. And U.S. News and World Report named us high performing, the highest distinction that it gives in 17 of 21 procedures and conditions that they annually evaluate, including orthopedics, urology, metabolic care, and the like. These ratings put us in the top 10% of programs nationally for clinical outcomes, nursing care, and the patient experience. And you can see from this list, our top-rated procedures and conditions reflect the great work of our Carilion Cardiovascular Institute. And if you go back in your mind to that video, you saw some of the scaling of that new tower. Well, that new tower, we've got a picture of it here. Might be easy if I do this. So right here is Roanoke Memorial, right? So this is what the new tower will look like. It'll connect directly. And it can go right from one floor to the other. The Cardiovascular Institute will move in 2025. The tower will also include a doubling of the emergency department, so a much expanded emergency department, a second helipad, and what everybody likes to talk about, more parking. With the new hospital tower well on its way, we're also rapidly moving ahead on yet another project, and that's cancer care. What Rendy didn't say is that I started my career as a cancer nurse, and so I think maybe I'm going back to the beginning and really focus now on cancer care. Our new state-of-the-science cancer center will replace a more than 40-year-old facility and form the centerpiece of a fully integrated program that is nationally recognized for cancer care, prevention research, and education. The new cancer center will be located in our Riverside campus, so off Reserve Avenue. Therefore, we will be tangentially attached to the Fralin Biomedical Research Institute. The Riverside 3, our medical office building, will do some renovation in that building so that we'll have a predominance of cancer care in that building as well. And it will give us the opportunity to bring in even more specialists in the area of cancer, and importantly, scientists, as we do a lot more research in the area of cancer and cancer care. New facilities also are important because they help us retain and recruit talented staff. People like to work in with the newest technology and the newest location, so we know that this is important for our staff as well. And as I said, we're really focused also on bringing in scientists and conducting more research, as well as providing outstanding patient care. Our architectural design team is from HDR, and they have designed over 90 cancer centers in the country and around the world, actually. And we have been going to various cancer centers around the country, learning from what went well, what didn't work so well, and what our opportunities for expansion are. And the project is the first we've had that's largely funded from philanthropy. You know, the two projects, the tower that you saw, the expanded emergency department, also I'm going to show you in a minute, our children's center, all of those were with money we had saved, basically, in bonds that we've let well before the pandemic. The pandemic was financially very difficult. We're going to talk about finances in a second. But when you look at all the things we could do and how many more we would like to do, the Cancer Center didn't rise to the top. Why? Because it's still a good facility and good care happens there. But my husband and I, my husband's a cancer survivor, thought, well, wait a minute, maybe we ought to do something different. And so we established a fund, and that now is part of the cancer campaign to fund this new cancer center. So we're on a $100 million campaign. We're $62 million into it. So even during the pandemic, we've been able to raise money. So we're really very excited about that. Well, speaking of children, our new children's outpatient specialty clinic, y'all have probably seen it. It's at Tanglewood. It's where the old J.C. Penney's was, so we still in our heads sometimes say, oh, they're at the J.C. Penney's spot. It opened in 2021. This was a bit of an experiment, going to a shopping mall for children's services. But at that time, part of the reason we were doing that is that we had a lot of children's services in different places. So, you know, a clinic here, a clinic there, wherever we could find space for our children's services. And interestingly, we actually have more pediatric specialists and subspecialists than any place else in the state until you get to King's Daughters in Norfolk. So more than UVA, more than VCU. Why is that? Because we have such a large geography that we cover, and we have a lot of children who have special needs. And what was happening, of course, is that moms bring their little son, their little daughter in, and they have to go to this doctor, and then this doctor, and this doctor. So they were spending a day or two or having to come back. It was not the ideal patient experience. So we co-located everything into one facility. A bit of an experiment. Would people like it? Would it be efficient? What about, would we meet our volume metrics? We have all these, what we call KPIs. We have all these metrics that we have to meet. It's far exceeded our expectation. It's a fantastic place, and I invite you all to come. Just walk in. It's perfectly fine if you do. It's beautiful and light and airy, and the children love it. And upstairs, we have a full dental services for children. And so just a month or so ago, we opened our mental health services. So pediatrics went so well, and we needed more ambulatory mental health and behavioral health services. And again, it was, would people with mental health issues want to come to a shopping mall? And would our providers feel comfortable working there, not quite at a hospital so close by? Well, the good news is that people are embracing it. It's incredibly successful. And I think in some ways, if you think about people with behavioral health needs, there's a bit of anonymity going to a shopping mall, and you're not stuck in all of the congestion that sometimes happens around a hospital. You can park, get at your service, but you might also need to go to the grocery store or go shopping. Likewise, for busy moms and dads with children, they can get some other things done. So pretty exciting what's happening there. And speaking of children, we've just been notified that Roanoke Memorial is again named Best Hospital for Maternity Care, and that's been true with U.S. News and World Report ever since they started offering that designation. So something to be very proud of. Our growing number of clinical trials and research collaborations point to an even bigger and brighter future for healthcare in our region. We are the nation's top enrolling site for many research clinical trials, particularly for those to improve stroke and heart attacks, and we're pioneering some new personalized cancer treatments. We have several very fruitful collaborations with research spinoffs from the Fralin Biomedical Research Institute, which helps fulfill our shared vision with Virginia Tech. At the same time, we're working to commercialize our own ideas with our in-house incubator called Carilion Clinic Innovation. And plans for creating a biotech incubator are moving along quite rapidly. We're going to be putting a new incubator right on Jefferson Street, and we're doing this in collaboration with Virginia Tech, but also with Johnson & Johnson. So Johnson & Johnson has named our area and our collaboration with Virginia Tech for a very strong partnership, and we're real excited about that. Where's that going to be? It's on Jefferson Street. It's, for those of you that are familiar with Roanoke, some of us call it the old C&P building, a Verizon building. It's a kind of a black two-story building right there on Jefferson Street. So we're repurposing that now for that incubator. And you know, I love talking about our medical school. Our joint ventured medical school with Virginia Tech is one of the most selective medical schools in the country. Only 10 years old, it already ranks as one of the top 100 medical schools in the country, and it's not 99, it's about 81, so that's a big deal. The class of 2027, the class we just admitted, for 51 students, had 6,100 applicants. 51 students, 6,100 applicants, and you know what? Nobody applies to medical school who doesn't think they have a chance to get in. You just don't do that. So incredible group of people, very excited about them. We now have several hundred alumni who have graduated with a 99% successful match rate into residency, many of whom are choosing to stay at Carilion. That thrills us. And even those who have left for a residency or a fellowship are now coming back because they love the region. They love the health care at Carilion, and so we're seeing the fruit of this experiment that we started with Virginia Tech now almost a dozen years ago. So we've talked about digital transformation. We've talked about quality care. Our third achievement I'd like to talk about a little bit is what we do to improve the community's health. You know, as we learn more about what affects health, it turns out that all the important things we do clinically are only part of the story. Sometimes I say your zip code is more important than your blood pressure. And so we work hard to help improve our community's health. And this is one example. It's called the Lift Center at Fallon Park Elementary School in southeast Roanoke. When we met with the Roanoke City leaders, school leaders, chief of police, the city council, and we said, you know, where's the best place we can do something? Where are the most important needs? And a little bit to our surprise, they identified southeast Roanoke as the place where 100% of the children qualify for free lunch and free breakfast. Huge needs in that region. And so, with a lot of planning and partnerships with Delta Dental, Freedom First, and the Roanoke City Public Schools, we opened this innovative school-based health and wellness center designed to expand access to care and resources and improve the health and well-being in that southeast part of Roanoke. The Lift Center provides pediatric care, dental care, and mental health counseling, as well as financial counseling and what I'll call old-fashioned home economics. Community health workers are embedded there and help families apply for health insurance, find transportation to medical appointments, and access nutritional food. That's a bit of a food desert in that area. And, you know, I had frankly, a manicurist who I got to know, and she was a bit overweight. She had hypertension. Began to talk to her a little bit about some things she could do. And here was my aha. She had to ride 3 buses. She didn't have her own car. 3 buses to get to a grocery store. Now imagine, and then 3 buses back, meaning you had to carry it. That happens all the time. It's a little bit under the radar, right? We don't realize what people have to go through. So when I'm telling her to buy fresh vegetables and fresh fruits and what to eat, and she's looking at me like I have 2 heads, because what she needs is some canned goods that can stay in her house and that she can cook quickly and that she can also transport. So these are some of the things that we're trying to help people understand. We have a garden over in Southeast. You know, I have to admit, when the staff came and said we want to hire a gardener, like a real farmer, I'm like, okay, what are we going to do with a farmer? But now I get it. We also do English as a second language, so teaching people English. A lot of people in the region don't speak English, all of which is free. And we provide volunteers to the 2nd grade to help them learn to read. One thing we know about if a child gets to 3rd grade, now some of us wonder, how can you get to 3rd grade without reading? But a lot of children get to 3rd grade and can't read. If a child gets to 3rd grade, the likelihood of that child growing up and going to prison is 8-fold. So that critical early time is so important. So this is part of what we're trying to do to help the community. And then because unmanaged asthma is a top contributor to the emergency department, one of the most important things we want to work on, LIFT provides a holistic asthma program as well. So as our region's safety net provider, we see needs for our patients and what the patients face every day, and we try hard to go deep and understand what the needs are. We provide millions in uncompensated care, including $20 million in financial assistance. We extend our impact into the community through grants to other safety net providers who share our mission. Well, we're one system made up of many communities throughout Southwest Virginia. And here are a few ways that we benefit the community. Our staff, hospital, and services are recognized for our community for quality, patient safety, and leadership. And we do this because it's important for those we serve. We are a service industry. We don't forget that, not a single day. And this is our mission. Our neighbors, you all are my boss. We don't have shareholders. You are our stakeholders. Which gets me to two challenges. Two challenges. First is workforce. Yes, workforce is a priority, particularly for clinical staff such as nurses, technologists, and even doctors. We knew there'd be a nursing shortage prior to the pandemic. After all, many women, nursing was largely women, not so much now, but largely women. Prior to about 1970, baby boomers, women went into nursing or teaching. And we've aged and retired. So you sort of knew this tsunami of aging baby boomers was going to happen. And we weren't filling up the ranks, in part because women had lots of opportunities, and I'm grateful for that. But what happened is that we had fewer and fewer people going into nursing, and then the pandemic hit. And the pandemic accelerated people leaving the profession, either because it was too hard, too painful, or they were planning to retire, we're going to put that off for a little bit, and the pandemic just tipped them over. So recruitment of nursing staff and other clinical staff is very high on our list. We've sort of sharpened our whole focus on workforce development. We're partnering with colleges and universities around to create broader and more sustainable pipeline. The thing is, we'll probably never have enough people. Maybe we never did. But we're very focused now on how do we redesign care. And I'll take your mind back to that Bluefield office, which doesn't have staff, right? It's a tele-hub. How can we do things differently so we're not so reliant on staff while at the same time we're providing high-level quality care that people need? And equally important is our financial recovery. So the pandemic was brutal to us financially. For the first time in a decade, in 2022, we had an operating loss. And likewise, we're just now finishing our fiscal year 23, and we're ending with a significant financial loss of about $30 million. Very significant. The things that we talked about, the new tower, the new emergency department, the children's services, all that was done with money prior to the pandemic. You know, we're a not-for-profit, so we don't need, our intent is not to give money to shareholders, is not to have a big operating margin, but you must have some operating margin to reinvest in the services and facilities and equipment that you need, and importantly, in staff. When I became the CEO, I went to the board and talked about this a fair amount. And I suggested to the board that we don't need a 10% operating margin. There are plenty of health systems that do, and that's their business. For us, I think as a not-for-profit, a 3.5% to 5% operating margin is our sweet spot. And the board agreed. And that's what we worked hard to achieve and maintain for nearly a decade until the pandemic hit, and now we're having to work our way out of that. So I want to show you a little bit. Financing for healthcare is very complicated. And I want to just show you this little view to help you understand. So this, if you can see here, the green line, the little green box with that line straight across would be what it costs us to provide care. Not what you charge, what it costs us to provide care. The little pink here that has the blue is patients who pay us nothing. The blue bar, which is our fastest growing area, is Medicare, or government payer. And as you can see here, Medicare does not pay what it costs us to provide care. We work every day to try to drive down cost, but the government will never pay you what it costs to provide care. Another growing area is Medicaid. Medicaid, likewise, does not pay us what it costs to provide care. In fact, in Virginia, there's a law that Medicaid can never pay you what it costs to provide care. So it's crazy, right? So what does that mean? Like, how do you make your money? Well, it's commercial insurance. So there's a cost transfer, a tax, if you will, to commercial insurance that covers your government payers. So all that in the red is what we need the commercial insurance to cover in order to break even. It's complicated. And it's just a pretty simple graphic, though, when you look at it. So where does that take us? Well, the bottom line is we are in a negative operating margin at the moment. We'll be working out of it. People ask me, how long is this going to take? I think it's going to take a couple of years to break even and get to a sustainable margin. As I said, we don't need a really big margin, but that's the situation that we're in now, and that's where we're working hard. The good news is we have a strong balance sheet. So even though we have a negative operating margin, we're still very successful in all the things that you've seen us do and more that we will do. But we have to fill that coffer up again. So a few fast facts, and then I'll close. The fact is, nearly 3/4 of health systems in this country are not-for-profit. And many are larger than Carilion. Sometimes people say, if you're a not-for-profit, that means you don't make a profit. Well, that's sort of true. Our profit goes back into the organization. And for Carilion, we're headquartered here. We are very faithful to that notion. And so all of what we do services our region and no place else. Well, I've talked about our 3 achievements. I've talked about 2 important challenges. And that brings us to what I said would be the last thing, and that's how can you help? And I would really like to ask for your support. And I ask for your support in a couple ways. I hope you always consider Carilion for your care, because it's the best place to get it. And encourage your family, your employees, your neighbors to do as well. Whether it's urgent care, primary care, or specialized care, we are here for you. If you have a less than ideal experience in one of our facilities, tell me. Tell us. We want to know. We want to know how we can get better. Second, encourage people to go into healthcare. It's a fantastic career. Sure, it's hard, but it's a purposeful career. And we need all these bright young minds to head into healthcare. And so encourage people, take advantage of that. And finally, if you're so willing and would like to be a part of our expansion, philanthropy is the name of the game, and we would certainly welcome your contributions. There's power in partnership, and I consider today my partnership with you and with this whole region. Like I said, we are headquartered here. I grew up here. I am committed to this region. I know our board is. I know our management team is. We are here to serve you, and we appreciate that opportunity. Thank you, Mindy. Randy. I don't know why I said Mindy. Sorry. Yes, ma'am. Of course.
Recently, a friend of mine passed, and she requested donations to the palliative care when my daughter-in-law, Christy Stewart, is medical director. And can you give us an address or email? So each of us, even if you only donated $10 or $15, it helps your foundation. Is that correct?
That's absolutely correct. And you said two important things. One is if you want to designate to something like palliative care, then you can be assured that that money goes just to palliative care. Do we have a piece of, Linda, do we have something to give them? Okay.
And one more thing, this is not a question. It's a thank you. My son, Dr. Jonathan Stewart, who is teaching residents and has clinical, was healthy as a horse when new to Roanoke. He experienced brain surgery,
Oh, my.
heart virus, a little stroke, but he's healthy and he is allowed to go 3/4 of the day so he can do his dream job. And he's a very conscientious doctor. He can do his dream job by coaching the cross-country team at Hidden Valley High School. So I want to thank his overseer, whatever it is, for giving him that opportunity. It's made
Thank
him
you.
a better doctor.
Thank you.
I mean, he's always a great doctor. Very professional. Thank you for your time.
Thank you. You know, sometimes numbers matter, and every time I say this, I'm like, what? So, Dr. Henning, we employ, where's Dr. Henning? Dr. Henning, we employ 42 orthopedists. Can you imagine? And in neurosurgery, we have 7 neurosurgeons, including our newest chair, Dr. John Jane from the University of Virginia, just joined us. It's just amazing the kind of care that we have now. Thank you for that story. More questions?
We now have a mic in the room, so if you all will hold your hand up, we'll get you a mic.
Thank you. I was interested in your view about the future. The U.S. healthcare system is probably unique in the world, at least amongst the major industrial countries, in terms of the relationship between the private and the public sector. In view of the challenges you noted in terms of the rapidly rising healthcare cost, particularly for this generation, do you see any fundamental changes occurring in that relationship between the public and private sectors?
You know, you ask a good question, and it's a perennial one. And there's a few things in that. One is, should we have Medicare for all? And you did see my slide that Medicare doesn't pay for the cost of care, so Medicare for all makes me nervous. At the same time, we have a lot of what I would call back office operation because of all the things we have to do to bill that a lot of our colleagues across the globe don't have. The fact is the commercial insurers in this country are very powerful. They employ a lot of people. They're a big part of the United States economy. I don't think, and they're very powerful politically. So I don't see major change happening abruptly. Having said that, we're aging. There was just an article in the newspaper this morning about that. And that Medicare number is growing, growing, growing. And you hear the government saying, we're paying too much for Medicare. Well, it's so surprising to me that anybody thought that was a surprise because we have an aging population. So of course we're going to spend more money on Medicare. But you've asked an important question, one we spend a fair amount of time. As Randy said, I was the chair of the American Hospital Association, spent a lot of time in Washington, and but I don't see it happening quickly. Despite all the noise, I don't see it happening quickly. But I think we're seeing some evolution. The other piece of that you didn't ask, but I think is important, is a lot of folks say, we spend a lot more money in health care in the United States and get less good outcomes. And if you just look very specifically, that's true. Except in trauma care and cancer care, it turns out, and we're best in the world for that. There's a difference, though, in what at least other developed countries do in terms of providing social services. So whether it's childcare or nutrition or social work, all those social services that aren't reflected in those numbers, that makes a difference. If you start looking at, some parity, then we don't do so badly when it comes to clinical outcomes. However, we do have health equity issues, and it's not so much a racial issue, it's a poverty issue. So if you look at people who live in poverty, and we have a lot of people in Appalachia, right, who live in poverty, their health needs are extraordinary, and their health outcomes are poor. And I carry that burden because our mission is to improve the health of the communities we serve. And these are communities that we serve. And it is hard to turn that corner. But when you just look at health outcomes, and you have to go a little deeper, look at poverty. The other issue is that we have more young people dying from gunshot wounds and suicide than, from the best of our knowledge, any place else in the country, in the world. And that's tough. Yes, sir.
One of the more frequent issues that come up in our small group conversations, and we always talk about medical issues, but it's access to care. And what ends up happening very often is that we're knowledgeable about our health, but we end up with urgent care kinds of concerns. And our direction as we inquire of our PCPs or specialists is, just go to urgent care, go to the ER. We can't see you for a week or 2 weeks, even though we have a relationship with that clinic or physician. Do you see this as a way of life for us?
No, I don't. I see that as a real problem and a barrier, and one we're trying to address head on this year. But it's not easy. As I said, we have a shortage of clinical staff, including physicians, and we're working hard, especially in primary care, to change that. We're also looking at how to expand hours. And one of the things that the Children's Center, what we did there, and not everybody was happy about it who worked there, was expanded to evening hours and Saturday hours. They're our most popular hours. Well, that's a lesson to us because people want to have care. The other thing is virtual care. And I mentioned we have two primary care virtualists. We're going to be adding to that group so that you can get virtual care for an acute need, urgent need, question. But there's more we can do, and we've got a team very focused on that right now. But I don't defend access is a concern. Other questions? Yes, sir?
I keep reading in the newspapers, mainly the national ones, that there's a extreme shortage of doctors and nurses throughout the United States. And that's partially related to there's a shortage of training facilities or med schools to train these doctors. You teach nurses and doctors. Are you planning on expanding the enrollment there? And what do you see happening in the United States? Because this sounds like it's a growing problem. It's not being fixed.
It is a growing problem, and it's one of those issues we especially are concerned about because people seem to think if you hire people in our region, you pay them less. Well, A, that's not true. And B, if you're trying to recruit somebody who could go to, pick your place, to go to Nashville or here, you may have to pay them more than they got they'll get paid there. So there's that. So I do think that's worrisome, but the good news is, yes, we have a medical school. It's a very, very good medical school, as you saw, and we've already increased it by 7. That doesn't sound like a lot, but there's a lot that goes into training physicians, but our intent is to grow that to about 125 students a year, and we're working with the state to get funding for a new building. And our relationship with Radford University is to grow that significantly for nursing education and other allied health. And we're working with other colleges and universities, including our community college system. The new chancellor of our community college system, David Doré, is our community colleges are not a system. They're one community college versus another community college versus another community college, and they may offer the same thing, but they call it different. There's not good reciprocity, so if a student's, in Radford going to New River Valley New River Valley Community College and then comes to Virginia Western, it doesn't work. We need that to be seamless, and a lot of the classes to be online. The other thing is that clinical education is expensive. So if you're president of a community college and you can teach an English class to 200 people and get paid for it with one teacher, hey, versus a clinical class where by regulation you can only have 10 people, 10 students, one teacher, what are you going to pick? Because everybody's looking for the right way to do that. But we're working very closely with them. But you're right, it's a growing problem in the United States, and I think artificial intelligence, machine learning, care redesign, telehealth are real promising for the future, so we aren't quite as reliant on a person. And I would encourage you to have somebody come and talk about AI, Chat GPT, and sort of blow your minds with all the exciting things that may be bringing. Any more questions? Yes, ma'am, Francis.
At the medical school, do they still have some sort of information to the public?
Oh, yeah, we do. We do programs at the Research Institute and the medical school pretty frequently. If you're not on that mailing list, or we can get you on those mailing lists. Thank you.
Don't go away.
Oh.
I just had a thought. That's always dangerous. Just ask my husband. Do you think that and Ben, don't listen. Do you think that in locations like this, it would be feasible, fundable, important to create the online capability right here, where we could contact Sam and I both had COVID, couldn't leave the apartment, couldn't go to a doctor, couldn't find a doctor that would take us, okay? I mean, it was a big problem. We both ended up with online medical appointments in the area. Doug, it was Dr. Pierce, it's across from where your guy's office used to be, where they have doctors that come in. I think the doctors rotate, but they have nurses that are permanent. And you can go in and you can get an appointment for just one time, just to handle an illness you have right now that you need to get taken care of. But you can't get into a regular doctor's office because they're too full. Is that something that institutions like this ought to begin to research? The establishment of a place here, right here at Brandon Oaks, where someone would be able to go into a room and have assistance with the computer to get the online appointment. Because not being able to operate a computer the way I don't operate a computer was a real problem. the facility and the assistance was there. I had to figure out how to get to it as a user. And that's what I wonder, not to be solved today, but would you guys think about it?
It would be nice to have a place where we get vaccinations.
Well, vaccinations, yeah. I'm not, anyway, put that in your, are we done with this lovely lady?
Well, you give me really great ideas. We can do, so we like the idea of a Apple bar. You know, well, those of you that use computers, you go up to the bar and they show you how to do everything. So I'll talk to your folks about that. And we can bring vaccinations here. Love to do that. That's pretty easy to do. We need people to get their vaccinations, and we'll take that home.
Thank you all so very much. Let's give her a big hand.
Thank you.
And this
Oh,
is,
my goodness.
this is for you.
Wow.
Now, folks, you may not know.
Look at this. Whoa.